As I alluded to in the previous section, psychosocial interventions like counseling actually are quite effective in helping patients stop or reduce their smoking. And compared to, let's say, no clinician involvement, some kind of in-person counseling, whether that's a physician or even a non-physician, actually dramatically improves the likelihood of the quit attempt by as much as, twice the success rate by having either a physician or a non-physician counsel patients about their smoking cessation. So I think physicians and psychiatrists should remember that we can actually have a big impact on our patient outcomes. And one of the probably the most important things we can do is help facilitate our patients to cut back or quit smoking. And so I think psychiatrists are in a very powerful position to help facilitate that. And this is really supported by numerous systematic reviews and a meta-analysis of 29 studies that determine that interventions by physicians actually improve outcomes compared to no clinician involvement or even non-clinicians. And compared to just simply giving advice on quitting smoking, motivational interviewing increases the quit rate by probably 25%. And indeed, if the primary care physician or a physician delivered the intervention, the relative risk was 3 times as much. So that's 300% more likelihood of being successful in the quit attempt. So this shows that the motivational interviewing approach is very effective. And single session, less than 20 minutes were still effective. So even with a time limit, limited intervention, this can be pretty powerful. Now, there's several approaches that are currently described on how to have this conversation. One of the older approaches identified by the National Cancer Institute is the 5 A's approach. And this is not a bad approach, and I think this should be sort of a quick way to sort of think about how to actually approach this conversation. And the 5 A's refer to ask, advise, assess, assist, and arrange. And the ask simply is to raise the issue and ask the patient about their tobacco use, and then to advise a patient that they should cut back or quit, and to assess their readiness for quitting or engaging in a change behavior, and then assisting them in that attempt, and then arranging for some kind of follow-up care or some kind of accountability. And so it's sort of a nice way to remember sort of the basic elements required in this conversation. Now, if you were to do something a little bit more sophisticated, actually the recommended approach is motivational interviewing. Motivational interviewing is a guiding style of communication that focuses on the language of change and really prioritizes evoking from the patient his or her own reasons for wanting to change. And of course, discussing the approach of motivational interviewing is completely beyond the scope of this webinar. But if you were to conduct a very brief motivational interviewing session, it may look something like this. You could first ask permission to talk about smoking by asking something like, would it be okay if we spend a few minutes talking about your smoking? And the reason why asking permission may be important is that this is one of the important principles of motivational interviewing is that we try to respect patient autonomy. And by asking permission, it actually implies that the patients can say no. But because they're being asked, patients actually feel like they're giving some control over the conversation. And then we can proceed to actually trying to evoke what we call change talk. This is language that indicates movement towards change. The opposite we call sustained talk, which is language that indicates maintaining the status quo or not changing. And so the goal of motivational interviewing is actually to evoke change talk, at the same time suppressing sustained talk. And so one quick way that you could try to evoke change talk is use what we call the taste of MI questions. And the 3 questions go like this. Something like, if you were to stop smoking, what would be the 3 most important reasons why you would do so? And what would it take for you to be successful? And then on a scale of 0 to 10, 0 being not at all important, 10 being completely important, how important is it for you to stop smoking? And then follow up that question with, okay, you gave me a 5. Why did you give me that number and not a lower number? And so these 3 questions, when asked, the answer to these questions actually is change talk. And so we're trying to evoke from the patient his or her own reasons for wanting to change and not the clinician to be the one arguing for change. Now, once you evoke these change talk, you can sort of then transition to the planning phase by giving first what's called a change talk bouquet and then combining that with a key question. So based on what the patient may have said to these questions, you could summarize that into a bouquet of change talk. For example, you're interested in stopping smoking because you think it'll give you more energy, they're costing you a fortune, and you're sick of the smell. You've tried it before and thought the patches really helped, and you know the reasons why it's important to stop. And then you can combine that change talk bouquet with a key question, something like, so what do you think you will do? Or, where should we go from here? Or what will you do? And so the basic idea here is we want to evoke from the patient his or her own reasons for wanting to change, and then summarize that back for the patient and ask, what are they going to do about it? And so this is a basic, sort of a quick recommendation of what a motivational interview and conversation may look like. Every state in the United States actually has access to a free 1-800 tobacco quit line, and it's 1-800-QUIT NOW. This is available at no cost to all states in the United States, available in English and many other languages. They offer counseling, advice, self-help materials, free or discounted medications and referrals. Unfortunately, utilization remains low because of a limited awareness, but strongly recommend that clinicians utilize this as an adjunct to the different psychosocial interventions that are offered. So key points. Physician counseling has an impact on rates of successful cessation, and therefore psychiatrists should be encouraged to engage in these conversations with their patients. A variety of approaches to counseling can be used, but motivational interviewing has the best evidence base, and the skill is useful in a wide range of clinical scenarios and target behaviors. And every state has a free telephone quit line that should be offered to anyone interested.